to pull together everything we've heard and learned in our program with her thoughts on mental wellness, PTSD, and suicide. Licensed psychologist Dr. LANAYA ETHINGTON is a therapist with Thrive Behavioral Health in Iowa City, Iowa. With teletherapy so prevalent nowadays, you can contact her for her services no matter where you might be located.
Thank you, Kent, for having me as part of your forum this morning. My name is LANAYA ETHINGTON. I am a licensed psychologist and I work in Iowa City, Iowa. I worked at the University of Iowa for 10 years before co-opening a private practice about 18 months ago. I want to say I am not a veteran, so I really want to start by just saying for those that serve, that have served, and that will serve, thank you for your service. And to also acknowledge the work of the first responders. Okay, so my role in this is to talk a little bit more about the mental health side of things. What are risk factors, what are protective factors? If you are experiencing thoughts of suicide, if you have a loved one or a friend or someone that you're concerned about that's experiencing thoughts of suicide, what do you do? My previous colleagues today have been really great with presenting some great information as to why this is such a concern. So looking at the National Institute of Mental Health and the CDC websites, we have some pretty alarming statistics. So in 2019, there were 12 million adults in the United States that had thoughts of suicide. And 1.4 million adults attempted suicide. There were 48,000 completed suicides. Suicide is the second leading cause of death for individuals ages 10 to 34, only behind accidents. And it's the fourth leading cause of death for individuals 35 to 54. The last thing that really caught my attention, I was looking this up, is that there are 2.5 as many suicides per year as there are homicides. And if you think about what we see in terms of media and news and awareness of issues, I would not say that we have as much awareness of suicide as we need to. I think the previous presenters have done a really great job of talking about experiences with PTSD and how that can be treated with various means. PTSD can be a risk factor for suicide. I want to differentiate between a risk factor and a warning factor. So a risk factor is something that would increase the chance that something might happen. It does not necessarily mean that it will happen. So if you go to your family doctor, for example, and they ask about family history of certain types of cancer, it's because it's a risk factor. It doesn't necessarily mean that you will develop cancer, but you might. So in terms of risk factors for suicide, family history is one of them. Having exposure to people in your life that have died by suicide, again, those are risk factors. A big one that I think about both in terms of my clinical practice and in my role as a parent and as a member of society is the role of adverse childhood experiences, specifically child abuse. So one study suggests that 80% of those that die by suicide have had some form of child abuse. So if we think about prevention, it starts young. How we treat our children, how we treat our communities, these are things that we can be doing in terms of building a better community from very early ages. Mental health disorders, particularly depression and suicide, those are risk factors. The majority of people that die by suicide are not involved in mental health treatment, and so that would be an indicator as well that in terms of reaching out and seeking help, that is a protective factor. Access to lethal means, and so as we've talked about today, having access to firearms, having access to ropes, driving across a bridge. So there have been studies done about the Golden Gate Bridge that was built and I think opened in 1935. And there have been 1,700 individuals that have died by suicide since it opened. 36 have survived that attempt. Kevin Hines is one of them, and he has become an inspirational speaker. And he noted that when he jumped off the Golden Gate Bridge, he experienced instant regret. And so he has written a book, and I think it's titled Instant Regret. But this was something that ultimately he did not want to do. I saw Kevin speak a few years ago, and it was really compelling. He talked about having a plan to go and jump off the Golden Gate Bridge, and was riding the bus on the way there, very despondent, very distraught, and said, I was just waiting for one person. I was just waiting for one person to see me, to ask me how I was doing. And if they had asked me if I had thoughts of killing myself, I would have been honest with them and told them yes. To reiterate other messages that you've heard from people today, asking someone if they have thoughts of killing themselves is not going to put it in their head. It is okay to ask. Physical illness, chronic pain, these are also risk factors. Feelings of hopelessness. So what research tells us is that the feeling of hopelessness is actually more of a risk factor than, say, severity of depression. So if that's something that you are hearing from people that you care about, that would be something to act on. Impulsiveness. So oftentimes, dying by suicide can be an impulsive act that had they waited or gotten the skills necessary to get through the psychological distress, they may have made a different decision. Barriers to mental health treatment. So as we know, access to health services in the United States, and certainly access to mental health services, is not equitable and sometimes can be problematic. So in terms of something that you can do, I would encourage you to vote. If you have thoughts about what it's like for people to have access to good health services, mental health services, I can say that it influences how I vote, how the people that represent me treat veterans. So exercise your right. Another risk factor is shame. And what we know is that people that serve in the military might have feelings of shame about experiencing distress due to some of the other values of toughness and strength. And so learning how to treat shame successfully is a big part of preventing suicide. Okay. Some protective factors. So what can you do? I want to leave you with some do's and don'ts. Protective factors would be effective access to good clinical and mental, physical health care. Access to a variety of clinical interventions. So there are different ways to treat different disorders. There are different ways to treat PTSD. I've been trained in probably 4 different ways to treat PTSD. If one intervention doesn't work, if one provider doesn't work, so if you are seeing a mental health person and feel like you're not making the progress, get hooked up with another one. I don't take it personally if people feel like they'd make better progress with another person. I really would just want people to make the best improvements that they can. My main takeaway, I would say, is connectedness. Feeling connection. Connection is the opposite of addiction. It's the opposite of loneliness. It's the opposite of many things that drive a lot of misery. I can appreciate that in the times of COVID, connection is difficult. It's hard. It may be different than what we're used to. So what I would say is to plan something specific. If you're going to reach out to someone, offer them something specific to do. Now, let's get together sometime. Let's plan a virtual date. Let's plan a socially distanced get together if appropriate, but not just say something that you're not likely to follow up on. Skills in learning how to work through your distress. So if you are somebody that's struggling with thoughts of suicide or mental health concerns, I really look at therapy as skill building. I try to help people build skills that we don't have and that we don't necessarily learn along the way. These are important things. How do we relate to thoughts that don't help us? How do we relate to memories that we don't like? We can't get rid of them. We don't have a delete button as humans, but we can have them in our lives in a different way. Just to reiterate what Dr. Miller had said in the morning, those basics really matter. So what we put into our bodies, how we sleep, in terms of exercise. The fastest way to induce a mental health symptom in somebody, so if somebody were in front of me that had no mental health problems whatsoever, and I wanted to induce one, we would just have to disrupt sleep. If you get a bad night's sleep for a night, you might be irritable. If you do that chronically, you start to develop other problems. If we want to change most quickly what's going on in your brain without a chemical, we can help change the way you breathe. When you change the way you breathe, the amount of oxygen that gets into the blood, it crosses the blood-brain barrier. So a lot of awareness about even just changing the way you breathe can help how you feel in a moment. And that could be the moment between doing something impulsive or not. In terms of, again, some do's and don'ts, so reaching out, expressing concern, asking directly, having resources. So Kent has been great about having here are phone numbers that you can call. There are places that you can text and chat. Affirming value and purpose, as we've heard some of our speakers say today, that having a sense of value and purpose of what they're doing with their lives has made a big difference. I also think about Randy was saying about the creative parts. So I encourage the people that I work with to do something that exercises the right side of your brain. The left side is the one that's got the language, sometimes those really problematic messages that people don't care about us, that we'd be better off. That right side, that creative outlet, those nonverbal things can really make a big difference. A few things that you may not want to do would be the call me if you need anything. That kind of puts the burden on the other person that might be struggling. If you've reached out to someone and they have not maybe responded, you can reach out again. Not trying to be a therapist to another person, especially if that's not what you're trained to do. If you're concerned about someone and they've expressed thoughts of suicide or threatening, there are places to call, 911 being one of them. And this is what I would do in my professional practice if I ever really worried about someone. To not tell someone to just get over it, snap out of it, or to undermine how they're feeling. If people are really opening up and being vulnerable, you can listen, you can be a support, you can be a good friend. You can do a lot of things that are really, really important in communicating that their life matters and that you want them to stay. And that was one of the things that really I took away from Kevin Hines' talk, is saying that's what I wanted to hear. To someone say that we care about you, your life matters, and we want you to stay.